No, no. Oh, my chest is starting to hurt.
Are you okay? Are you okay?
You have the manager call 911, see if they have an AED. If they do, bring it back.
When someone's heart stops beating, blood stops flowing through the body. CPR can help keep a person's blood flowing until other medical care can be given. The most important part of CPR is pushing hard and fast on the chest when you give compressions. When you push on the chest, you pump blood to the brain and heart. So let's focus just on compressions right now and take a look at how they should be done. Move clothes out of the way. Put the heel of one hand on the lower half of the breastbone. Put the heel of your other hand on top of the first hand. Push straight down at least 2 inches with each compression. After each compression, let the chest come back up to its normal position. This lets blood flow back into the chest. You'll need to give compressions at the rate of at least 100 per minute. Put the heel of one hand on the lower half of the breastbone. Then put the heel of your other hand on top of the first hand. When I tell you push straight down on the mannequin's chest, remember to push hard and push fast. After each compression, let the chest come back up to its normal position. Get ready and begin. Push hard and fast. Try to keep time with the beat until the drum beat stops. When you push, make sure the mannequin's chest moves down at least 2 inches with every compression. After each compression, let the chest come back up to its normal position. Continue to compress at the rate of at least 100 beats per minute. If someone else knows CPR, take turns by switching at least every 2 minutes, even if you're not tired. This will help make sure your CPR is effective.
I know CPR. Can I help?
Move quickly to keep the pause and compressions as short as possible. While you are resting, remind the other rescuer to push down at least 2 inches at a rate of at least 100 compressions per minute, and to let the chest come back up to its normal position after each compression. To open the airway, follow these steps. Put one hand on the forehead and the fingers of your other hand on the bony part of the chin. Then, tilt the head back and lift the chin. It's important to avoid pressing into the soft part of the neck or under the chin because this might block the airway. While holding the airway open, pinch the nose closed with your thumb and forefinger. Take a normal breath. Cover the person's mouth with your mouth. Give 2 breaths. Blow for 1 second each. As you give each breath, you should look down at the person's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Now, open the airway and give 2 breaths with a mask. Repeat.
Start with compressions.
Sometimes a person's heart doesn't work right and the person needs CPR. An automated external defibrillator, or AED, is a machine with a computer in it that can shock the heart to make it work properly. If you start CPR right away and then use an AED within a few minutes, you'll have the best chance of saving a life. To use an AED, you simply turn it on by either pushing the on button, it should be clearly labeled, or lifting the lid. Once you turn on the AED, you'll hear voice prompts telling you everything you need to do. Follow the instructions on the AED pads to decide whether to use adult pads or to use child pads or a key or switch. Adult pads are used for someone older than about 8 years of age. First, turn the AED on. Push the on button or open the lid.
Attach pads to the victim's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the victim. Shock needed. Charging. Stay clear of victim.
Clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
For the purposes of this course, a child is anyone who is older than 1 year and has not yet reached puberty. If there's any question about whether or not the person has reached puberty, treat the person as you would an adult. One difference between adult and child CPR is how compressions are done. When giving compressions to a child, you may only need to use one hand. However, you should still be able to push down about 2 inches. If you can't do this with one hand, then use two. Now, open the airway and give 2 breaths. Watch for the chest to rise and reopen if necessary. Repeat. A common emergency with children is choking from food or some other object being stuck in the airway. Some choking is mild and some is severe.
I mean, did you like the movie?
Yeah,
It was pretty good, you know, it was good. And later on we can go to the park if you want. Son, are you choking? Someone help!
What's wrong?
I'm not sure, I think my son is choking.
Are you choking? Okay, I'm going to help you, okay?
If a child is experiencing severe choking, you must act quickly to get the object out so the child can breathe. When a child has severe choking, give thrusts slightly above the belly button. If the child is smaller, you may have to kneel to get into correct position. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If the choking child is very large, put your arms under the child's armpits and your hands on the center of the child's chest. Pull straight back to give thrusts on the chest instead of the abdomen. If you cannot remove the object, the child will stop responding. If this happens, then giving compressions may force the object out. If the child is not breathing, immediately give 30 compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for objects after each set of compressions. Make sure the infant is lying on his back on a firm, flat surface. If possible, use a surface above the ground. Move clothes out of the way. Put 2 fingers of one hand on the breastbone just below the nipple line. Press the infant's chest straight down about 1.5 inches. After each compression, let the chest come back up to its normal position. This lets blood flow back into the chest. You'll need to give compressions at the rate of at least 100 per minute. Remind each other to push down about 1.5 inches at a rate of at least 100 compressions per minute, and to let the chest come back up to its normal position after each compression. Just as in adult CPR, opening the airway correctly will help keep an infant's tongue out of the way to make sure your breaths are effective. Opening the infant's airway too far can actually close the infant's airway, making it difficult to get air inside. Follow the techniques you're about to learn to make sure you open the infant's airway correctly. If you give a breath and the chest doesn't rise, quickly reopen the airway by allowing the head to go back to the normal position and then open the airway again. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and pushing fast on the chest again. A common emergency with infants is choking because of food or some other object being stuck in the airway. Some choking is mild and some is severe. Use the following to find out if an infant has mild or severe choking and what you should do. If an infant can make sounds or cough loudly, then the choking is probably mild. You should be able to stand by and let her cough. But if you're worried about her breathing, call your emergency response number or 911. If an infant cannot breathe or has a cough that has no sound or cannot make a sound at all, the choking is severe. Act quickly by doing the following. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto her back, supporting her head. Give up to 5 chest thrusts using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until she stops responding. If you give an infant back slaps and chest thrusts and the object still doesn't come out, the infant will stop responding. Pushing on her chest may force the object out. Lower the infant onto a firm, flat surface. Then tap and shout.
Baby, are you okay?
If the infant doesn't respond, then yell for help.
Somebody help me!
Check for breathing. Immediately push on the chest 30 times. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for objects after each set of compressions. After 5 sets of compressions and 2 breaths, if no one has come to help, then call your emergency response number or 911.